The Embu County government calls it a land of opportunities. But is this the reality for all sectors, including health?
Get any facility in this county, randomly. Go to their stores and you see there's plenty of medicine.
Some encouraging feedback from, among others, pregnant mothers of Embu.
Kama huku kuna operation, ni vizuri ndio ni karibu.
Join me, Irene Choge, as we put a spotlight on Embu County this week on the Health Assignment County Edition, only on NTV. About 120 kilometers northeast of Nairobi is Embu Town, the headquarters of Embu County, with a population of slightly more than 500,000 people. A few more kilometers from here is Mbere, a semi-arid region of this otherwise very fertile area. Cradled in his mother's arms, 7-day-old Daniel Munyaka circles, oblivious of the number of visitors who have paid him a visit on this day. Being a firstborn to these young parents, Munyaka is actually a special child. But his being special extends to the county at large, as he is a product of the first ever cesarean section delivery at Mbere Sub-County Hospital in Siakago, which is just a few kilometers from his home. Although the theatre room has been in existence at the hospital for more than 4 decades now, it was until 21st of September this year that the hospital recorded its first delivery through CS.
Currently, we are able to offer comprehensive obstetric care. That is one of the essential package of the Kenya health policy. So initially we were referring all cases, maternal cases, to Embu PGH that needed to be operated on. And also any complications that will arise as a result of delivery that needs examination and anesthesia were being referred to Embu PGH. But as of now, we are able to handle that.
With the improved infrastructure at the facility, doctors had no reason to worry when 23-year-old Susan Wawera developed complications during childbirth. In this community, the name Munyaka means good luck. And for this family, they decided to call little Dennis Munyaka because they felt lucky that just within their community here, they are able to get to a health facility that offers theatre services.
Mafikira yangu alifikiri nitaenda Embu nifanye sanjale halafu nilipe.
Na hapa Siakago ulilipa?
Hapana, sikulipa.
The joy of getting medical assistance just within their locality is one that is also shared by other mothers of this county, only that many of them are yet to fully accept the changes.
Akaniambia mtoto atatolewa. Nikamuuliza tutaenda mpaka Embu ama? Akaniambia ati huku kuna vanyiwa operation. Mimi nikastuka. Nikanjiuliza kama ni huku daktari wa huku kweli wataweza kufanyia mtu operation ama wanataka kunifanyia vibaya.
We sensitize the public. We've had some people talking to the people around in church and even on the local FM stations about the availability of theatre services here. And we are also telling them not to fear because we have experienced doctors, nurses here. They are well trained and they are up to the task.
Nilifurahia sana juu penye nilikuwa nasikia kama ni Embu sijui kama ningefika.
It is this kind of encouraging feedback that the county's leadership says motivates them to continue working towards improving the health sector.
We are now in the process of adding facilities to these level 4 hospitals. Already we have finalized and operationalized theaters in Chiakago and Runyenjes, level 4 hospitals. And the other 4, before the end of the year, they will also be having operational theaters.
Embu Level 5 Hospital, which serves 4 other counties, has had a CT scan machine installed. This is expected to help diagnose muscle and bone disorders, and patients would need not to travel to Kenyatta National Hospital for this service. An MRI machine has also been installed. With the construction of its own oxygen production plant, Embu Hospital now saves at least 4.2 million shillings, money previously used to buy oxygen. A new renal unit complete with dialysis machines is also under construction. The unit, upon completion, is expected to attend to up to 10 patients per session. This 3-storied complex, when complete, will house a 6-bed intensive care unit and 6 HDU and a cancer screening unit and a maternity theatre.
Being a unit, you can be able to plan and to be able to offer that service as and when it's required.
But even with these projects, there are still challenges.
Kwanza kuna wataweka CT scan pale. Mbele tulikuwa mtu anaandikiwa naenda kupigwa mahali kwingine. Sasa hii ikikuja hapa na mtu atakuwa anakuja hapa hiyo siku anamaliza hiyo kazi. Hiyo ni kitu kimoja. Hili nyingine kuongezewa madaktari wa surgery. Kama sasa mimi nimekuja hapa mara kama 5 naenda nyumbani, sasa nimefanikiwa sasa hivi. Unaona? Sababu kama kuna madaktari wengi wa theater
the issue of medical personnel has been of great concern to many counties, with those posted there perpetually on strike, complaining about delay in payments and the lack of promotions. However, Embu County medics are among the few in the country who didn't take part in the nationwide strike.
We are evaluating their performance. We have already promoted 38 of them. And we have another bunch of 36 which are being processed. And that's why things are quite quiet here, cool, because we engage the medical personnel regularly and we have not had any issues this year.
These promotions no doubt means more money, but this county, just like many others, say it would be important to ensure the improvement of the working environment, as that has also been a reason behind having demotivated workers. The issue of drugs is also another concern.
The last consignment of drugs received are funded by the county through KEMSA has actually been one of the biggest consignments we've received, and as a result of that we are able to fill out many prescriptions 100%. And also the non-pharmaceutical supplies, these are the gloves, gauze, other things like that. We've had it's one of the also biggest consignments we've ever received, so that you find we don't have shortages.
There have been many fasts for the devolved health sector, like the birth of this child, an indication that there is hope for the sector, but this will require vision and prudent management.
Devolving the function of health was the best thing, one of the best decisions, or one of the best features of the new constitution.
The Makueni County has had its fair share of troubles as far as politics is concerned. But politics aside, the county is slowly but surely picking up, with health transformation key on its agenda, to an extent that even the county governor himself gets treated at the public health facilities here in the county.
I stay here, I work here, so if I'm unwell, I go to hospital here like everybody else.
Join me, Irene Choge, this time in Makueni County for the Health Assignment County Edition, only on NTV. The hilly landscape welcomes you to Makueni County, a county that lies in the arid and semi-arid zones of the eastern region of the country. It is home to more than 800,000 people residing in Makueni, Mbooni, Kaiti, Kibwezi East, Kibwezi West, and Kilome sub-counties. With a vision where resources are sustainably harnessed and equitably shared for the benefit of every household, the health sector is one area that no doubt affects every household here in Kenya, and financing in this area is key.
The national government, for example, for development in 2012-13 was spending 11 million for development. That is building infrastructure, you know, all those development things. In the first year of 2013-14, we spent 220 million. In the second year, we spent 238. That is last financial year, 2014-15. From those figures alone, it is clear that we changed the face of the health.
Indeed, the changed face can be seen as you enter the Makueni County Referral Hospital. The polished walls and the clear labels to the clean floors gives you a different feel not usually associated with public hospitals. The sound of sick children playing just outside their ward is nothing but refreshing. These young ones seem to have forgotten the ailments that brought them here, all thanks to the environment that the hospital's management says was deliberately worked on to ensure tranquility and in turn help in healing.
Kama mama nimeona ni nzuri kwa mtoto. Hata ingawa uwezi achilia mtoto hapa chini sababu mtu anaweza vomit, lakini naona kunaoshwa kila siku. Mara tunaambiwa kama ni takataka tukusanye mahali pamoja tunapeleka huko nje kabisa. Hakuna kuweka hapa.
More often than not, public hospitals are usually associated with congestion and dirt. But looking at this children's ward here at Makueni County Referral Hospital, well, one would be forgiven to think that this is actually a private hospital.
Inafurahisha. Hata alikuwa ananiuliza ile ni nini, nikamwambia ni cartoon. Tena nikamtembeza na huko nje nikamuonyesha akafurahia.
Ngusha, uliona mood yake ilikuwa?
Alifurahia, nikaona amesikia raha. Enyewe nimeona huku ni kusafi, tunashughulikiwa. Hata kutembeza mtoto nimeona anafurahia sana.
This feeling of being in a private health facility, not to say that some of the private ones are any better, is also one that is being felt by mothers here. The maternity wing is fully kitted with these electric adjustable beds that have since replaced the usual hospital beds.
They are good because you can always adjust them according to the patient's condition. For example, if a patient goes into DAB or distress, respiratory distress, you can always recline it such that you raise the patient's head for easing breathing, yeah, as you administer other measures of first aid. You can also adjust the leg position depending on also the patient's condition. For example, patients with DVT or deep venous thrombosis, you can adjust so that you can raise the patient's feet, yeah, or even in shock, you can also do the same in order to encourage circulation to the head and the vital parts of the heart, yeah, that way. So it actually helps in managing of patients better and giving better medical care to patients.
And given that this is a semi-arid area, the hospital is taking advantage of the weather, ensuring that sufficient hot water is available for the use of patients and other needs.
Our money is very clearly targeted so that there is significant value for the money.
But the building of health infrastructure is not just in the county hospital. Sultan Hamoud Sub-County Hospital is one among the other hospitals that have slowly been receiving a facelift since the devolution of health. With a digital X-ray machine and a theatre now awaiting commissioning, residents are expecting access to treatment to be even better, and they wouldn't need to travel to Wote anymore.
I don't think I would have gotten such services in a central government hospitals, but in the sub-district counties where devolution has brought everything to Mwananchi, everything is okay and we are getting all the services.
We are experiencing quite a big change as far as services are concerned. We hardly miss medicines when we come.
But it is not all about curative health.
Our focus has been primarily on preventive and promotive health as a key area of investment in health. We do health education in all our facilities so that mothers are taught the importance of family planning, importance of immunization, importance of hospital deliveries.
The involvement of community health workers has also proven beneficial in meeting specific health targets.
In 2013, for example, only 19% of our mothers were delivering in hospitals. Through these strategies, we have seen an increase of skilled birth deliveries to 58% to date. We have also witnessed an increase in the immunization coverage. We have also seen an increase in the uptake of family planning commodities.
The Makindu Sub-County Hospital is also another facility that has received tremendous growth. A new trauma center has been built and is awaiting commissioning. Located along Mombasa Road and with no major hospital along this highway prone to motor accidents, the new trauma center is just the ideal project. It is also at this hospital that I personally got to experience the services on offer. Well, having been in different counties and luckily being in a hospital facility, during my interview with the doctor, my persistent cough made him immediately notice that I have a chest infection. And what a better place to be, because I got help immediately. While on bed rest for a couple of hours, I came to learn that even the governor gets treated at this facility. This I had to ask during our interview at his offices the next day.
Well, I don't think it is special because I stay here, I work here. So if I'm unwell, I go to hospital here like everybody else. There was a time I had some operation and I went to Makindu and was treated very well. It was very cheap, about 5,000. If I'd gone to Nairobi, it would have been like $500,000. When I have issues, I go here at Wote.
Apparently, 90% of public servants, including senior officials, are confident enough to seek medical attention at the government health facilities here.
And we have very good doctors and very good health personnel as a whole. And I have confidence. That's why if I will go to another place, it's because I'll be referred, having gone in the first instance to a hospital here.
Although it is usually the norm for senior government officials to seek treatment even abroad, by his example, Governor Kibwana seeks to change that and even restore the public's confidence in public health facilities. Like other county heads, despite the challenges in the health sector, Professor Kibwana is hopeful that the sector is going to improve. That is, if the progress already made is anything to go by.
I don't think one can say we are defeated as governors or county governments in terms of delivering the health function. On the contrary, I believe that most counties, we are doing much better than previously.
Irene Choge, NTV, for the Health Assignment County Edition in the county of Makueni.